121. Airborne precautions are required for all viral infections. True or false? Answer: false rationale. Airborne precautions are specific to pathogens like tuberculosis or measles, while other viral infections, e.g., influenza, require droplet precautions per CDC guidelines. 122. The nurse should assess a patient's respiratory rate for a full minute. True or false? Answer: true rationale. Assessing respiratory rate for a full minute ensures accuracy, especially for irregular patterns, providing reliable data for clinical decisions per assessment standards. 123. All medications require a physician's order for administration. True or false? Answer: true rationale. Medications require a physician's or authorized prescriber's order to ensure safety and legality, except in specific protocols, per nursing practice regulations. 124. A warm bath is contraindicated for patients with fever. True or false? Answer: false rationale. A warm or tepid bath can help reduce fever by promoting heat loss through evaporation, a safe non-pharmacological intervention, per fever management guidelines. 125. Restraints can be applied without a physician's order in emergencies. True or false? Answer: true rationale. In emergencies, restraints can be applied to protect the patient or others, but a physician's order must be obtained promptly per CMS and Joint Commission standards. 126. Therapeutic communication includes giving advice to patients. True or false? Answer: false rationale. Therapeutic communication avoids giving advice, instead encouraging patients to explore their own solutions to promote autonomy and coping per communication principles. 127. Hypercalcemia can cause constipation and lethargy. True or false? Answer: true rationale. Hypercalcemia, high calcium, slows gastrointestinal motility and affects neurological function, causing constipation, lethargy, and potentially confusion. 128. The nurse should administer medications through a nasogastric tube without checking placement. True or false? Answer: false rationale. Nasogastric tube placement must be verified, e.g., via pH testing or X-ray, before medication administration to prevent aspiration, per safety protocols. 129. A bedridden patient's linens should be changed daily. True or false? Answer: true rationale. Daily linen changes for bedridden patients prevent skin breakdown, maintain hygiene, and promote comfort per standard nursing care protocols. 130. Incident reports are used to punish nurses for errors. True or false? Answer: false rationale. Incident reports are for quality improvement and risk management, identifying system issues, not for punishing nurses, per facility and safety standards. 131. A temperature of 38.5 degrees Celsius is considered normal. True or false? Answer: false rationale. A temperature of 38.5 degrees Celsius 101.3 degrees Fahrenheit indicates fever, not normal, 36 to 38 degrees Celsius, requiring assessment and intervention, per fever management guidelines. 132. The nurse should use a transfer board for patients with limited mobility. True or false? Answer: true rationale. A transfer board facilitates safe movement for patients with limited mobility, reducing injury risk for both patient and nurse, per safe handling guidelines. 133. Pain assessment is only required for patients with visible injuries. True or false? Answer: false rationale. Pain assessment is required for all patients, as pain can be internal or chronic, e.g., neuropathy, guiding appropriate interventions per pain management standards. 134. Nurses are responsible for ensuring medication reconciliation at admission. True or false? Answer: true rationale. Nurses participate in medication reconciliation at admission to verify current medications, preventing errors, per Joint Commission patient safety goals. 135. A heart rate of 50 beats per minute is normal for an adult at rest. True or false? Answer: false rationale. A heart rate of 50 beats per minute is below the normal range, 60 to 100 beats per minute, for an adult at rest, indicating bradycardia, requiring assessment. 136. Standard precautions include wearing a mask during all patient interactions. True or false? Answer: false rationale. Standard precautions require a mask only for procedures with splash risk, e.g., suctioning, not all interactions, per CDC infection control guidelines. 137. Fluid overload can cause weight gain and jugular vein distension. True or false? Answer: true rationale. Fluid overload increases intravascular volume, causing weight gain and jugular vein distension, indicating potential heart failure, per assessment standards. 138. Nurses can share patient information with other nurses during shift changes in public areas. True or false? Answer: false rationale. Patient information must be shared privately during shift changes to protect confidentiality, avoiding public areas, per HIPAA regulations. 139. The nurse should apply moisturizer to a patient's skin during hygiene care. True or false? Answer: true rationale. Applying moisturizer prevents skin dryness and breakdown, especially in immobile or elderly patients, as part of routine hygiene care. 140. Ethical nursing practice includes respecting a patient's right to refuse care. True or false? Answer: true rationale. Respecting a patient's right to refuse care upholds autonomy, a core principle of ethical nursing practice, per the ANA Code of Ethics. 141. Droplet precautions require a private room for the patient. True or false? Answer: false rationale. Droplet precautions do not always require a private room. Cohorting with similar infections is acceptable if a mask is worn, per CDC guidelines. 142. The nurse should document a patient's response to pain medication. True or false? Answer: true rationale. Documenting a patient's response to pain medication evaluates effectiveness and guides further treatment, ensuring continuity of care, per charting standards. 143. All patients should be encouraged to ambulate immediately after surgery. True or false? Answer: false rationale. Ambulation post-surgery depends on the patient's condition and surgical type. Some require delayed ambulation to prevent complications, per recovery protocols. 144. A cold compress can reduce swelling in acute injuries. True or false? Answer: true rationale. A cold compress reduces swelling by constricting blood vessels and decreasing inflammation in acute injuries, per non-pharmacological intervention guidelines. 145. Nurses can delegate medication administration to unlicensed assistive personnel. True or false? Answer: false rationale. Medication administration is a nursing responsibility and cannot be delegated to unlicensed assistive personnel, per scope of practice and safety standards. 146. Cultural competence includes avoiding assumptions about a patient's beliefs. True or false? Answer: true rationale. Cultural competence requires nurses to avoid assumptions and assess each patient's beliefs individually to provide respectful, patient-centered care. 147. A respiratory rate of 16 breaths per minute is normal for an adult at rest. True or false? Answer: true rationale. A respiratory rate of 16 breaths per minute is within the normal range, 12 to 20 breaths per minute, for an adult at rest, indicating stable respiratory function. 148. The nurse should administer medications prepared by a pharmacy technician. True or false? Answer: false rationale. Nurses must verify medications prepared by others, ensuring the 5 rights, and should not administer without checking, per medication safety protocols. 149. Proper hand hygiene includes using hand sanitizer before gloving. True or false? Answer: true rationale. Hand sanitizer before gloving reduces pathogen load on hands, enhancing infection control, especially for non-sterile procedures, per CDC guidelines. 150. Incident reports are required for all medication errors. True or false? Answer: true rationale. All medication errors, even near misses, require an incident report to analyze causes, improve systems, and enhance patient safety, per facility policies. 151. The nurse should use a sterile technique for dressing changes on surgical wounds. True or false? Answer: true rationale. Sterile technique is required for surgical wound dressing changes to prevent infection, as these wounds are at high risk for contamination, per infection control guidelines. 152. All patients require call light within reach only during the day shift. True or false? Answer: false rationale. A call light must be within reach at all times, day or night, to ensure patient safety and access to assistance, per Joint Commission standards. 153. Documentation should include the nurse's initials and credentials. True or false? Answer: true rationale. Including initials and credentials in documentation ensures accountability and identifies the responsible nurse, per legal and charting standards. 154. Daily shampooing is necessary for all hospitalized patients. True or false? Answer: false rationale. Daily shampooing is not necessary for all patients and may dry the scalp. Hair care should be individualized based on patient needs and condition, per hygiene protocols. 155. A blood pressure of 130/85 mmHg is considered normal for an adult. True or false? Answer: false rationale. A blood pressure reading of 130/85 mmHg is classified as stage 1 hypertension, not normal. According to the American Heart Association guidelines, normal blood pressure is defined as less than 120/80 mmHg. A reading of 130/85 mmHg requires monitoring and appropriate management. 156. Hypernatremia can cause seizures and coma. True or false? Answer: true rationale. Hypernatremia, high sodium, causes cellular dehydration, leading to neurological symptoms like seizures and coma, requiring careful fluid management, per electrolyte balance protocols. 157. The nurse should administer medications without verifying the patient's identity. True or false? Answer: false rationale. Verifying the patient's identity using two identifiers is critical to prevent medication errors, per the 5 rights of medication administration and Joint Commission standards. 158. Deep breathing exercises can reduce pain perception. True or false? Answer: true rationale. Deep breathing exercises promote relaxation and oxygenation, reducing pain perception as a non-pharmacological intervention, per pain management guidelines. 159. Nurses can withhold information from patients to avoid distress. True or false? Answer: false rationale. Withholding information violates patient autonomy and trust. Nurses must provide honest, appropriate information, per the ANA Code of Ethics and Patient Rights. 160. Silence is an effective therapeutic communication technique. True or false? Answer: true rationale. Silence allows patients to process emotions and share concerns, fostering trust and reflection as a key therapeutic communication technique.